To be discussing laryngitis and the anatomy and physiology of it. Laryngitis is a swelling of the larynx, which is also referred to as the voice box. The vocal folds, which play an important role in typical speech production, are located within the larynx. Since the vocal folds are located in the larynx, when one has laryngitis, their vocal folds are also inflamed. This is an image that I found which does an excellent job at demonstrating laryngitis. Here, it shows that laryngitis impacts the larynx. Further, it demonstrates how the vocal cords are located within the larynx and are impacted as a result of laryngitis. On the left is an image of healthy vocal cords. These vocal cords are not inflamed and they are able to vibrate properly in order to produce speech. Meanwhile, on the right is an image of vocal cords one would have if they had laryngitis. As seen in this image, these vocal cords are swollen, which, as I will get into more detail about later, will impact speech production, as it will affect the vibration of the vocal cords. Here is a real-life image of laryngitis. From this photo, it is clear that the individual has an inflamed larynx as well as inflamed vocal folds. Laryngitis leads to a range of symptoms that affects one's voice and throat. The most common symptoms include one's voice becoming hoarse, a person losing their voice, a person experiencing pain in their throat as a result of the inflammation, and a person having an uncomfortable feeling in their throat. This uncomfortable feeling could lead to an individual having the urge to cough. There are two types of laryngitis. These are acute laryngitis and chronic laryngitis. Acute laryngitis is short-term. After the cause of acute laryngitis goes away, the laryngitis ends and there are no more symptoms experienced by the individual. Meanwhile, chronic laryngitis lasts long-term. To be classified as chronic, the symptoms must last for at least 3 weeks. Chronic laryngitis could lead to other problems, such as the person getting vocal nodules. Acute laryngitis could be caused by infections, such as viruses and those caused by bacteria. Additionally, it could be caused by the overuse of one's voice. Meanwhile, chronic laryngitis could be caused by living a lifestyle where one is constantly overusing their voice. For instance, professions who are constantly using their voice, like singers, are at a higher risk of chronic laryngitis. In addition, an individual's daily behaviors, like constantly smoking and drinking alcohol, could lead to chronic laryngitis. Along with that, being exposed to and taking in certain irritants, such as chemicals, could lead to the condition. Lastly, acid reflux is another cause of chronic laryngitis. Before understanding the anatomy of laryngitis, it is important to comprehend the basic anatomy of a healthy larynx. The larynx is located below the throat and it goes into the trachea. An important feature of the larynx is that the vocal folds, which are essential for speech production, are located within the larynx. There are 3 sections that make up the larynx, which are the supralarynx, larynx, and sublarynx. The supralarynx is the uppermost part of the larynx. It consists of the false vocal cords. The larynx is the central part of the larynx that consists of the true vocal cords. The sublarynx is the lowermost part of the larynx. It joins into the windpipe. The larynx is made up of cartilage, including the epiglottis, thyroid cartilage, cuneiform cartilages, cricoid cartilage, corniculate cartilages, and arytenoid cartilages. This is an image that demonstrates the anatomy of the larynx. It shows how it is located between the pharynx and the trachea. Further, the image illustrates that the epiglottis, supraglottis, vocal cords, glottis, and subglottis are all located within the larynx. This is another image illustrating the anatomy of a healthy larynx. It shows the cartilage that makes up the larynx. From this photo, we could see that the epiglottis is located at the top of the larynx. Additionally, the photo illustrates that the cricoid cartilage is located below the thyroid cartilage. Along with that, we see the location of the false vocal cord and the true vocal cord on the image on the right. Also, it depicts that the arytenoid cartilages are found on the posterior side of the larynx. Further, the image illustrates that the corniculate cartilages are located right above the arytenoid cartilages. This is a great image to look at in order to comprehend what the anatomy of the typical larynx looks like. In regards to the anatomy of laryngitis, when one has laryngitis, their larynx becomes swollen. More specifically, A big anatomical change from a healthy larynx to an individual who has laryngitis takes place in the vocal folds. Changes are seen in the vocal folds, the most common one being edema, which is swelling. As a result of the swelling, the vocal cords become larger in size. When a person first acquires laryngitis, the vocal cords, epiglottis, and arytenoids swell and become red. As laryngitis becomes worse, the swelling of the vocal cords worsen, and they continue to become more red as well. With laryngitis, an individual's subglottic portion of their larynx typically does not undergo any anatomical changes. This photo illustrates the anatomical changes that are seen with laryngitis. Compared to the normal vocal cords, it depicts how laryngitis leads to the inflammation of the vocal cords. The size of the vocal cords enlarge as a result of the swelling. In addition, the image showcases the erythema that results from laryngitis. In order to better understand the physiology of laryngitis, it is important to first comprehend the physiology of a healthy larynx. The larynx is important for both breathing and speech production, but today I am going to be focusing on discussing its role in phonation. In a healthy larynx, air pressure builds up and causes the vocal cords to vibrate together in order to create sound. Later, those sounds will be shaped by articulators in order to produce all the various sounds that make up speech. As the vocal folds vibrate to form sounds, they are coming in and out. Adduction is the process of them uniting, meanwhile abduction is the process of the vocal folds separating. Depending on the speed in which a person's vocal cords vibrate, it will affect the pitch of their voice. This contributes to whether someone may speak in a higher or lower pitch. Furthermore, tension and length of the vocal cords contribute to pitch. For instance, a person will have a deeper pitch if their vocal cords are longer. Here we see the vocal folds vibrating to produce sound. The top image showcases abduction, as the vocal folds are apart. Meanwhile, the bottom image shows adduction, as the vocal folds are brought together. Further, this image demonstrates that air is expelled from the lungs, through the trachea, then to the larynx, where the vocal cords vibrate to create sound for speech. When looking at the physiology of laryngitis, it is important to remember that, as I had discussed prior, with laryngitis, one's vocal folds are inflamed. This inflammation changes and affects vocal cord vibration. As I described earlier, vocal cord vibration is what produces sound. Therefore, if the vocal cords are not vibrating properly, then they will not be able to create the sounds that a healthy larynx would be able to. As a result, this causes the most common symptom of laryngitis to be the voice becoming hoarse. Since vocal cord vibration is not working properly, the hoarse voice is a result of the deformity of the sound being formed. Furthermore, a lost voice is the result of the vocal cords becoming too swollen that no vibration is taking place. Without vibration, no sound is produced. Therefore, without the formation of sound, an individual cannot produce speech. Additionally, swollen vocal cords impact the size of the vocal folds. As described earlier, vocal fold size contributes to the pitch of the voice. Therefore, a person with laryngitis may experience changes in the sounds of their voice as a result of the enlarged size of their vocal cords. These are the references I used for my presentation.